Think about an interaction you recently had with a patient. Were you confident that they completely understood what you were talking about? The healthcare system places an enormous burden on people to understand and use health information, from understanding how to take medication or understanding a medical procedure well enough to give truly informed consent, to being able to understand and apply all the information required to manage a chronic condition or to make decisions about their health. And as healthcare professionals, we provide the majority of this health information to our patients or clients. And the way in which we communicate this information can have a strong influence on how people look after their health and ultimately can affect health outcomes, so things like anxiety or depression, medication management, and diabetes complications. So, to solve the problem, you'll need to dig 50 metres at a 45-degree angle. And when you're 15 metres along, turn facing southwest and then grind the pipe channel with the gas orbital till at 34 degrees. This should work. So what can you remember about what I just said, and what did you understand? So that was a fairly extreme example, but studies do show that about 50% of our patients don't understand or remember what they've been told by a health provider. So how can we help prevent these gaps in communication? Teach back is a chance for us to check when our patients don't understand and, if necessary, reteach the information. It provides an opportunity for health professionals and patients to work together to clarify misunderstandings, and it makes patient education our responsibility, and it can be used at any time and in any context. So there's 4 steps in Teach Back. The first step is to use simple terms to explain and demonstrate. The second step is to ask the person to repeat back in their own words. The third step is to identify and address or clarify any misunderstandings. And the fourth step is then to ask the person to repeat everything back to you in their own words. And sometimes you'll need to repeat the entire process until understanding is achieved. I'm just going to talk through each of these steps in detail now. So for step 1, using simple terms, minimize medical or other jargon that you're using. So for example, clarify the meaning of words. So if you're using a word like hypertension, explain what hypertension means. Avoid using acronyms such as BP, and avoid words with multiple meanings such as dressing or negative. So if you tell someone that their X-ray was negative, for example, they may think that that's a bad thing. And assume that all patients, regardless of factors such as education level or language or age, are vulnerable to not understanding. As health professionals, medical jargon comes to us naturally, and it's easy to forget that some of these terms are difficult words for many of our clients. So instead of saying benign, saying not harmful will make much better sense to many people. But patients do sometimes say that they just wished all providers spoke the same language. So maybe it's better for you to use the complex words that you know other providers will use, but just explain them. So the next time their specialist uses a word like hypertension, the patient will know what it means. So the second step in Teach Back is asking the person to repeat back to you what you just told them. So it's not a test of the patient, but rather of how well you explained the topic. So how might you ask someone to do this in a way that's not demeaning to them? So some examples of this are, what will you tell your spouse about your condition? Or the changes we've made today, or we've gone over a lot of things you can do to remember to take your tablets. Can you let me know how you think you'll make it work at home for you? Or you can ask in ways that take the pressure off of the person. So for example, I want to make sure I explained everything clearly. Can you please explain it back or tell me back in your own words what you heard me say so I can be sure that I did? And it's really important to not ask clients simply if they understand or if they have any questions, because most times people just say no, especially if they haven't understood. Instead, you need to ask specific questions about how they'll put this information into practice. So for example, can you let me know how you'll make this work at home for you? And then the third step in Teach Back is to address any misunderstandings. And again, it's important to avoid demeaning the person. So some simple, gentle phrases here might work. And this is a vital step in teachback because it's so often at this point that the aha moment comes for the health provider when they realise the assumptions that they've been making about what they think their client knows or understands are actually incorrect. Take time over this step and be really clear that the person fully understands before you move on to the next step. To finalise the process of teachback, ask the person to repeat the whole thing again in their own words. Just asking them to repeat anything that they got wrong means that they might only remember those bits. So ask them to tell you from the beginning again in its entirety. Then, if they demonstrate understanding at this stage, that is, if you feel completely confident that they know what they need to do, then you can provide positive feedback and, if possible, next time you see them, check their understanding or their retention of what you've told them. We can call this successful completion of this step closing the loop, because if teachback has been successful, then it's closing off some of those gaps in communication that we talked about earlier. It's unusual to not close the loop, but it might take several goes, and it might mean that each concept or key message is taught separately. If teachback hasn't been successful, you need to repeat the process. Usually up to 3 times is enough, but if not, it might be time to consider other strategies or other reasons why the person doesn't seem to understand. And one reason might be that you're trying to teach too much at any one time. So one way of simplifying your education is to deliver short, key messages only, and then use teachback. So we call this method chunk and check. When we speak with patients, we typically have to explain more than one concept. We know that people struggle to understand long lists of things to do, and yet this is often the way that information is presented in the medical field. So the chunk and check method of communication can help you understand whether your patient has heard you correctly. After you've communicated one important message, a chunk of instructions, you check how much the patient understood by using teachback. And then you go to the next concept or message. Repeat the process, and then the next. Often if a patient has a question over any one point in a conversation, they might save their question until the end, and holding on to this question will often affect their ability to understand the rest of what's being said. So chunk and check addresses that concern by stopping the conversation to insert teachback and other techniques to ensure understanding. So teachback not only helps clients to understand and use information or education, but it also has benefits for the health worker. It provides them with deeper insight into the difficulties that their clients experience in understanding information and in applying that information to their own circumstances. And it also provides real feedback to the worker about the way that they communicate and about the assumptions that they make around their client's knowledge. And ultimately, this might lead to a stronger relationship between the healthcare worker and the client because it promotes a conversation, and this in turn can build a rapport and a good level of comfort and trust. As with any clinical or medical encounter, teachback isn't a one-size-fits-all approach. You'll need to be flexible in applying the technique, so some clients will need you to use teachback just once, and others will require a much gentler or tailored approach. And you'll need to determine when and even whether teachback's appropriate. But if it doesn't seem to be working, consider some other options, such as seeing if another person can do the teaching. Or try and identify what some of the potential barriers might be, such as motivational issues. Sometimes, though, it's important to just recognise that you might need to put other supports in place, such as medication dispensers or more home support. And teachback might take longer initially, but is something that can be built upon, especially if you see the person again and again. So if possible, the next time that you see the patient, reinforce the teachback. See if they remembered what you told them and built on the knowledge that they have gained from you using teachback.